Hello, my name is Alyssa Book, and today I am going to be talking to you about gender influences on overuse injuries. The first study we are looking at, by Lau et al., examines lower limb sport-related overuse injuries in young adults. The subjects were 506 cases of injury. The results showed that all except for one overuse condition had an earlier onset age in the females. The authors of this study mentioned that the fact that the overuse injury study almost always coincide with the growth and maturation of children, and concluded that since females mature faster than males, that this was the reason why they saw that earlier onset in the female group. The second study we are looking at, by Taunton et al., examined 202 reported injuries in runners. These runners presented injuries related to running and were evaluated at the Allan McGavin Sports Medicine Center in Canada. Results showed that women had a higher number of patellofemoral pain syndrome, IT band syndrome, and tibial stress syndrome, tibial stress fractures, femoral stress fractures, and greater trochanteric bursitis. As you can see from these results, the women had predominantly more overuse injuries than their male counterparts. Because Taunton et al. Found these differences between males and females, Ferber et al. Questioned if the biomechanical differences in the lower extremity during running could be a potential determining factor of overuse injury. The study wanted to determine whether or not there were any potential biomechanical differences during running. Subjects were 20 male and 20 female recreational runners who were evaluated during their running. Results showed that the female runners showed a significantly greater peak hip adduction, hip internal rotation, and knee abduction angle. They also showed significantly greater hip frontal and transverse plane negative work. In conclusion, since differences exist in running mechanics, this study presents this as a possible cause of gender influences on overuse running injuries. Switching gears, Sturgalalis et al. Looked at injuries sustained in male and female amateur basketball players. The subjects were teams from the Hellenic Basketball Union in Greece. Results of this study showed that the males sustained more overuse injuries than their female counterparts, which is the opposite result that Taunton et al. Found. The last study we will be looking at, by Marburg et al., examines the correlates between low bone density and stress fractures. Results showed that females who sustained stress fractures had a lower average bone density than their healthy counterparts, and that many of those females who had sustained stress fractures had menstrual irregularities. In conclusion, the authors concluded that mental irregularities had an impact on the risk for a stress fracture in female. This concludes the presentation on gender influences on overuse injuries. Thank you.